I'm Dr. Tiffany Chan. I'm an assistant clinical professor, Omega Chi alumna, and this is my Katie story. I think I was interested in medicine probably in middle school, but my passion, I think, for med school started with my biology major in college. Breast radiology is a specialty that not a lot of people have heard about. It's imaging, medical imaging that is related to the breast. We take care of women and also men related to breast cancer, breast infections, literally anything you could think of that's related to the breast. Breast radiology to me is a combination of both diagnostic and intervention. I spend part of my day reading medical imagings, and then I spend another part of my day discussing results with patients from their imaging and also doing procedures. I'm an academic radiologist. I have trainees, which consist of medical students, residents, and fellows. I do lectures for all these different levels. I'm actually the fellowship director at UCLA for breast radiology, which means that I have a very hands-on position in helping our fellows during their last year of specialty training before they go out into the real world. I also do a lot of research projects. I work with different departments in my institution to answer big questions that can impact patient care and clinical workflow. If you're 40 and above, you should be getting annual screening mammograms. If you have any changes in your breast, whether it be a lump, skin changes, or nipple changes, make sure that you see your primary care doctor or your OBGYN, and you will be able to get some breast imaging to see if there's anything that's happening there. When I went through recruitment at Cornell, I remember it being a very energetic and fun time. I got to meet so many great sisters of all the different sorority houses, but Kappa Delta really struck a chord with me. My parents were a little bit nervous about me joining the Greek system, mostly because they wanted me to focus on grades. There is the stereotype that if you are social and that if you join a community like a sorority, you won't be able to focus on the things that you come to college for. I think that in high school, I had really great grades, but I have to say that my confidence was probably lacking outside of the classroom. I don't know if I felt confident about my social skills or my ability to contribute to a community until I reached Kappa Delta. Kappa Delta really fostered that independence that I think every modern woman needs in her career and in her family life, and it also creates that idea of how important a community and a family can be. I honestly think that being part of the Kappa Delta sorority has helped me realize how important teamwork is in the professional setting. You know, especially in medicine, either fortunately or unfortunately, you can get by pretty far by caring only about yourself and working on your own grades and how you do well on tests, that sort of thing. But at the end of the day, for instance, when we are hiring people to join our practice, what we look for is a team player. I think it has reflected to all the people who've allowed me to rise up through the ranks. And I think that is part of the reason why I was chosen to be fellowship director. And it's something that I really look for in all of my trainees as well too. Some of my KD ties are actually my best friends. These are lifelong friendships and relationships that you will never forget. These are people who've seen you at both your best and sometimes at your worst, but you know that will always be there for you. And I think that's what Kappa Delta really means to me.